and welcome to the Alleviant Health Show. I'm Nick Angelis. I'm one of the owners of Alleviant Health Centers of Akron, and I'm a nurse anesthetist. And today we have with us Britney Sorello from Alternative Therapeutics. She's a licensed independent chemical dependency counselor and a licensed professional clinical counselor supervisor.
Yes.
Don't forget that dash S. So welcome to the show.
Thank you so much for having me. I'm excited.
Absolutely. So typically, from what I believe in these type of shows, the first few minutes are spent with us explaining why we're experts, what we've done in our lives that makes us so good at what we do. Mm-hmm. But let's skip all that. Maybe we can do a little bit later.
Sure.
And start right away with neurofeedback and biofeedback. Because
Awesome.
What we both do is a lot of different techniques for mental health. For me, pain as well, since I'm a nurse anesthetist. And a lot of them have nothing to do with medications. And of course, we know that the Western model of medicine of healthcare is, here's your medication, I'll see you in 2 months, here's another medication. Mm-hmm. So what is it that you do with neurofeedback and biofeedback? And can you explain those? Because those are both the type of terms that everyone's like, oh yeah, that's great. And we'll nod our heads and we'll smile, but
Sure.
we really won't know what we're talking about.
Yeah, absolutely. So yes, neurofeedback and biofeedback are two forms of using technology that can help us to create more balance in our brain and body in a really simple way. So biofeedback is an umbrella term for using technology to show us what our brain and body is doing, right? So we can give you information about how you're breathing, how your heart's beating, what your muscle tension is doing. With neurofeedback specifically, we're looking at the electrical activity of the brain.
Okay.
And by using technology, we can show the person what their brain's doing and help them to modulate the activity of their brain. And with that, we can create some really positive changes.
Okay, great.
Yeah.
I did a graduate project on biofeedback when I was in anesthesia school, actually.
Oh, cool.
We developed a video game that could look at your heart rate variability and teach you how to be mindful and deep breathing and all of that. Mm-hmm. So is that part of it too, the heart rate variability, and how does that all work?
Yeah, so that's the form of biofeedback that we use most frequently with our clients. So heart rate variability, it teaches a deep breathing technique that allows your heart rate to create a consistent and steady pattern that then sends signals to your brain that you're calm and in control. So it's really great for anxiety. It can be helpful for alleviating pain. Mm-hmm. And it just helps the person feel more calm and centered. So that's one form of biofeedback that we use.
Wow.
Yeah.
That's really neat. For sure. Because I think a lot of times too, we don't have control, meaning that we think, well, I better see my therapist because I'm having a bad day, or I better take my medication because I'm more anxious.
Yes.
So what you're saying is we can empower ourselves, and so that way we can almost teach ourselves how to not completely fix anxiety and depression, but to be an active member in trying to get better.
Absolutely. Yeah, we use neurofeedback and biofeedback as tools in more traditional type of therapy or counseling to help empower the person and give them the reins back, if you will, to have control over their mind, to have control over their emotions, so that they don't rely on us forever, right? Because as therapists, that's our goal, is to be able to, help a person get to the point where they can manage their own lives and they don't rely on us and need us anymore.
Sure.
Yeah.
So how can it work without the technology? Meaning, obviously at Alternative Therapeutics, you have all the equipment you need, but which parts of that can people translate into their own daily lives?
Yeah, so a really big part of what we do is what I call the 5 pillars of brain health. And so these are lifestyle techniques that are really important that we are preaching and teaching to all of our clients. So those 5 pillars being diet and nutrition, exercise, sleep, stress management, and cognitive stimulation, or keeping the mind active and challenged. So with those 5 things, if we can teach the person how to make lifestyle changes in their life and incorporate those 5 things, eventually, when they leave us, they're going to have all the tools and all the pillars in place for them to, live their very best life after leaving us.
No, that makes a lot of sense. So we have a lot of clients that come to us and say, I just want supplements, or I want something holistic, and we're willing to do so. I have a background in holistic medicine as well. But at the same time, usually I say, well, wait, let's do something a bit more powerful, and so you'll see some progress, and then you'll feel inspired to continue on with whether it's a supplement or self-care or whatnot, but a lot of times what I've noticed is that when we try to start with eat some healthy fats, they'll be all gung-ho, and then a week later they're like, well, I'm still sad, this didn't work.
Sure, yeah.
So that kind of makes sense, where you can really start with some heavy hitters, so to speak, that will get the ball rolling, and then as the patient or client sees some better effects, then they'll be more willing to kind of take it the rest of the way.
Absolutely. That's what we notice with a lot of our clients too, is people may have experienced depression or anxiety for a really long time. They're like, I haven't been to the gym in years. I just haven't had the motivation to do it. And so neurofeedback can really help give you the boost to start amping up that motivation. And then they'll start to notice themselves going to the gym and taking better care of themselves and getting more sleep, and all of that kind of snowballs and has a cumulative positive effect over time.
Okay, great.
Yeah.
No, that makes a lot of sense. And I think it's the same with us, where a lot of times we'll do TMS, for example, transcranial magnetic stimulation, and it works for anxiety or depression, OCD, but it's the same thing where it tends to work best when it's sort of subtle. I mean, I had one patient saying, I don't know if this is going to help me with OCD, and then she came back a few days later saying, well, it was Saturday morning, and I was laying in my bed, and I realized I didn't care that there were dishes to do. So just that more subtle approach, because as we know, medications tend not to be subtle. I mean, it might take a month for it to work, but once it works, it's like, okay, my brain's working differently, and I don't know if I like it, but there's a definite change. So I feel sometimes therapies where your family members are the ones that tell you, okay, you're a little different now.
I say that all the time. That's so funny, because that's what a lot of our clients will notice too, because neurofeedback can be subtle, and they're like, I don't know, like maybe something's happening, but I'm really not sure, but my wife swears that I'm nicer, and my kids are like, Daddy, you're so happy, and those are the things that we really get excited about, because when the family notices, then that really shows that there's some changes happening, because we live our own experience all day every day, and so we can miss the things that are happening because we're always in our own head, and other people will notice though, so that's what's cool.
Or sometimes I feel that we get attached to our illness, so it's part of us, and someone else has to tell us, that's not you anymore.
Yeah.
Like, you're used to being sad and complaining about this thing, but sometimes I'll tell patients, here's some testing we did, your depression's gone, so you can now stop acting like it's still there.
Sure,
Which can be an awkward conversation, but still necessary one. That, do you really want to get rid of this illness, or do you want to keep it with you like a little buddy at all times? And it's your choice.
Yeah, that's a really good point.
Because I've seen, even with our ketamine infusions, which can change brain chemistry immediately, we have some patients who, it's like, okay, we've done everything chemical that we can do to your brain. We've done everything electrical that we can do to your brain. Now you just have to decide, do I want to form a new identity, or do I want to keep this identity of sickness? And I'm not saying that in some cases an identity of wellness isn't any better, because I have, again, some experience in holistic health. There's this concept of, I must earn my health. I'm eating 80% organic. Once I reach 100%, then God or the universe or someone will bequeath me with this perfect health because I've earned it. And I feel that can be a very damaging sort of philosophy too.
Absolutely.
It's not too dissimilar from eating disorders or something like that, where
you just
okay,
kind of
this
become
is how I
obsessive
look.
with it and expect a certain outcome, but that's not always, the case.
Right. Yeah. Exactly. So, and I did have one question as well. Is it true, or is it more of an internet myth with the bioavailability or the biofeedback, where your heart starts beating at the same rhythm as someone you like or something like that? I'm trying to think of a better way to word it. Because I heard it on the internet, but it's basically that with heart rate variability, your heart starts mimicking the pattern of other people that you're with.
Sure. Yeah, I think that I can't give you a really scientific answer on that one, but I do know that there exists a synergy that we can feel off of each other, whether it's heart rate patterns or brainwave patterns. All of us have been in the situation where we enter a room of somebody who's really anxious or really upset or angry, and we can just feel it. We don't even have to see their face. We vibe off of that, right? And so I think some people are more in tune with that than others, but definitely, I think that definitely occurs. And so when we see people, and oftentimes we treat entire families because one person starts to get better, and then they're like, I need to bring my kid in, I need to bring my husband in. if one person starts to get better in the household, then that can really shift the energy of the entire household, right? And so that's definitely a cool aspect of what we see as well.
No, that makes sense. And as more of a medical person, when I first read that, my immediate thought was, well, if someone has atrial fibrillation, and I was like, okay, stop geeking out about
Sure, yeah. Yeah, I think it's more around just the energies, and like when our heart is racing or we're feeling really anxious, like that creates a whole, neurochemical pathway in our bodies that emits much more than just a heart rate that we can sense from another person.
No, absolutely. And we see that too, because at our practice, it is therapy and psychiatry. And I have to say that's the majority of what we do is people come in, they get their medications like any other psychiatric practice.
Sure.
It's simply that for those who are willing, we have a lot of other options. But because we either have people who just feel a little down and they want something a bit more holistic and gentle, or those who've tried 20, 30 different things or different medications and it hasn't worked, many of those patients, the difference we can tell is when they come in and like the atmosphere doesn't suddenly start sinking in the entire practice, because that's how sick they've been, where it's almost an aura. And of course, one of the things we do is Spravato and ketamine infusions. And although obviously it's scientific, there's a lot of research behind it, parts of it are mystical. So you'll see changes in just the atmosphere around a patient.
Yeah.
Which is why all these things you have to be very careful with and set expectations and educate and all that. But I think one thing that we can struggle with, and I'm sure it's for your practice too, is how do we educate in that we have a lot of patients who come in because, we've heard you have the latest and greatest, no one else has these innovative therapies. How can we say here's the latest, here's cutting edge technology, but yet not market it? And what I mean is we don't want people to just disregard the normal things that every day we do to do our self-care, to self-soothe. Instead, they want whatever is the shiniest or the newest or the best.
Yeah.
And I can understand that. No one wants to go from Zyprexa to Zoloft to Paxil and try every drug, and then after that, once they've burned out all the receptors, try something different. But how do we strike that balance between here's something new and improved, and okay, it's not healthy to just seek out everything.
Every shiny object out there.
Right.
Yeah. I definitely see a fair amount of clients like that, because I personally work with a lot of entrepreneurs and professionals and athletes and things like that are looking just to become the best versions of themselves. And so along with that sometimes comes this perfectionism, where they're always wanting to just be the very best version of themselves and never really feel fully settled on the amazing person that they are. So I work a lot with those people in kind of setting realistic expectations and practicing a lot of presence and gratitude and mindfulness to really start to appreciate where we're at, because tomorrow's, of course, never promised for us, and we have to just learn to appreciate where we are in the moment and focus on the good that we do have, because it can be just a vicious cycle to always be focusing on finding the next shiny thing. And I really like to teach people just to be present and enjoy their current experience.
Right.
Yeah.
No, that makes sense. And on some patients, I do throw everything at them, meaning, so we have Spravato, which is a ketamine nasal spray that is covered by insurance. And it works really well for some patients, but for others, it takes a very long time to work. So we combined it with the transcranial magnetic stimulation, which again is more electrical signals to find those parts of the brain that where the neurons are dormant or when they're firing too much. And we'll combine that, but that's more of a concept of, okay, I realize you've tried 11 different therapists and you've been to 6 different psychiatrists, and we really only have like 1 or 2 weeks and you'll give up on us too. So we might as well go with everything that we have. And then there's others who we won't even put them on psychiatric medications. We'll say, no, okay, you need some evening primrose oil, here's what you need with your diet. And what you said about the family, where we can't just treat one person. Now we can, but it's not going to be sustainable. No matter what the treatment is, they'll be coming back for the rest of their lives.
Sure.
Just because if you can't change your environment, then how can you really change your brain? So we've had that same thing where it's like, this is great. I think your wife needs some treatment too.
Yeah, absolutely. You know, a lot of people come to us who are in similar situations where they've tried a lot of different medications, they've tried a lot of different therapists, and they're really feeling kind of at the end of their rope and looking for something new and different. And fortunately, you know, we're able to help the vast majority of those people because we do offer something that's different. It's more of a direct approach. So we have the therapy, we have the counseling there to help you through, you know, those difficult moments and those changes that you're going through. But the technologies that we introduce can really help push the person in the right direction a lot faster and a lot more efficiently than maybe the traditional routes that they've tried before.
Right, that makes sense.
Yeah.
So what's something that we can do on our own for mindfulness? For example, for a while I lived in Florida, and so I was really into earthing, where you would just stand outside barefoot and just be mindful, be in nature. And that's great a couple months out of the year here in Ohio, but you know, if I start doing that in November, I'll just get frostbite.
Sure.
I might be more in tune with my body and really mindful, but I still want to use my feet.
Right,
you know?
right, exactly.
So, and I noticed that during quarantine too, that's like, okay, just staring at the wall, whether it's meditation or prayer, like there's some limitations to what I can do self-care. So I really believe in nature as a way to heal ourselves, but what can you teach us, a technique or something to that effect of how we can sort of be in the moment and let go of the constant anxiety? And for me, I mean, we were talking beforehand how I was sending an email at 1:30 in the morning. So
yeah, Nick, we got to work on that.
Right. This is action intervention. The whole purpose of this is just fixing me.
Fix Nick, yeah.
Right. Sorry that you all thought you were going to get some information here. It's all about fixing me.
He needs help. Okay, so a technique. Well, I have so many, you know, rattling around in my brain. I really like using the senses to ground us, to make us feel present. So I call it the 5, 4, 3, 2, 1 technique. So you're using all of your senses, which really, it's good for feeling overwhelmed also. Like if your brain's kind of moving a million miles a minute and you feel scattered and you don't know where to start, if you have a lot of things on your plate, this can be something that really helps kind of center you and get you back to zero. So 5, you're using your vision to identify 5 things in your environment. And if you're alone, you probably want to do this out loud, right? So I see the table, I see the plant, I see my shoes, you know, so you're naming 5 things that you see, and then you're identifying 4 things that you can touch, and you want to actually touch them. So you want to feel the difference in texture on your pants versus your skin versus maybe your hair, and just really like dig into that sense and really notice the differences in texture. And then 3 is 3 things that you can hear. And so if you're in a quiet environment like we are now, you really have to kind of settle in and focus on what you can hear. 2 things you can smell, and then 1 thing that you can taste. So it's usually like the last thing that you ate or drank that you're noticing in your mouth. And so then you try and bring all of those senses together and intertwine sight and sound and touch and vision and smell and taste, and try and notice all of those things all at once. And that can really be pretty powerful in forcing your brain to be more present and in the moment. So that's one of my favorite grounding techniques and centering techniques that I teach to clients.
Wow.
Yeah, it's a good one.
Yeah, absolutely. And again, the whole purpose of this is empowering people. So your practice is in Cuyahoga Falls, mine's in Fairlawn. Obviously, we're in Wadsworth right now.
Yeah.
And it's not as much that, oh, everyone, we're your last hope, you've got to come to our practice. It's just more that concept of, you know, how can we be in touch with our senses and be in touch with ourselves to know when we need help. Because I've honestly told some patients, I don't think you need us. You're pretty good.
Sure.
Move along with your life and use some of these basic things that we've taught you, and you should be set. You know, call us if you need us, but there's no need to schedule another appointment. And I think that's very important because, not to get political and controversial, but a lot of our health system is based on, okay, we can bill for this, and oh good, we didn't fix them, so they can come back, and now we can bill for that. So it's structured for people not to get better,
right?
For them to always be dependent on you.
Sure. So. And I think, one of the things that we talked about in the past that I'm enthusiastic about in Northeast Ohio is there's more and more people like us, more and more people that are more holistic practitioners who are providing a a long-term solution instead of a pill for an ill type of solution, right? So I think more and more people are learning that medication certainly serves a purpose, but it's not the be-all, end-all for a lot of people, and it's not a solution. It works as long as it's in your system, but then when it's not in your system anymore, you don't feel good anymore, right? And so I think more and more people in this area are branching out and looking for more long-term holistic options, and that's really encouraging for me because I've lived in different parts of the country, and I see that it's more prevalent in different parts of the country. And Northeast Ohio has been a little slow to catch on, but I think we're finally getting on board, and I think that's exciting.
So if someone's interested, how do they kind of cut through the fluff and find out what'll work for them? Because as we've said, you with neurofeedback and biofeedback, me with the TMS and the ketamine, there's a lot of different options out there. And I feel the internet stopped being useful for researching these things around 2012, 2013.
Sure.
So how can someone sort of kind of understand, okay, this isn't just, eat some tofu and be happy. This is actually something that it might be holistic, it might be gentle, but it's going to work. Is there, and obviously patient testimonials are one thing, but every diet shake on the market has at least one person who lost 200 pounds on it.
Right. Yeah, no, I think that's a good question. I talk about this often too, is the importance of making sure that you're finding a practitioner that is licensed and certified and trained and all of that. Like, we are both licensed professionals, right? So that's an important aspect. In my field with neurofeedback, you don't have to necessarily be a licensed professional to purchase the equipment and use it. And so for me, that's pretty scary. And so, if you find that neurofeedback or biofeedback specifically is something you want to look into, you definitely want to make sure it's being provided by a licensed professional, and also preferably somebody who is certified in providing that, like has done specialty training in providing that as well. So that's a big thing for me. And with any therapy, you just want to make sure that the person who's providing it knows what they're doing and has some training and research and background in it.
Okay. Yeah. It makes a lot of sense. It's the same with me in anesthesia. You probably don't want someone who's like, look, I saw this on YouTube. I think I've got this.
Sure. Right. Yeah, that sounds pretty terrifying.
Right. So how can people reach you if they are interested in alternative therapeutics and your specific practice?
Yeah, so our website's a great place to start, www.trainyourbrainohio.com. There you'll find all of our contact information that you need. We also have recently started a podcast. I hope to have Nick on it one day soon. We have a blog. We're trying to do all the new age things that are important. So, check out our website. It's a good place to get started.
And for us, Alleviant.com. Our number is 330-754-4844. You can just call, ask for an appointment. Like I said, we have psychiatry therapy as well. And a crucial thing is, especially since we like to share patients, is that we don't take you away from your current provider. So I think that's the issue in mental health, is that sometimes people have a really good connection with who's giving them their care, and yet they feel, well, can I get better? What's the next step?
Sure.
And it can be difficult, I feel. So we try to make sure that all the connections, like the people who really know you, matters, because again, mental health is different. It's not something that works in the slightest with, I don't know you, I've heard your symptoms, here's your prescription. I mean, that can work in the short term, but we've seen a lot of the effects of that. So.
Right, the therapeutic alliance, as we call it in my world, is very important. And so to have somebody that can provide some interventions, whether that's medication or neurofeedback, biofeedback, alongside of a good professional therapeutic relationship, I think that's really where the magic is.
Right. With
your approaches or mine.
Yeah, absolutely.
Definitely.
And I think one thing I learned today is that I need to do more self-care, so I'm not sending you emails at 1:30. So maybe I'll nap after this show.
Yes, that sounds like a good idea.
Great. Well, thank you all for joining us. Again, I'm Nick, and this was Britney, and we enjoyed having you here on the Alleviant Health Show, and we'll see you next time.
Thank you.